So thanks for joining all of our attendees and our panelists. It's 5, so we'll begin now. Welcome to episode 8 of ConneXions, a webinar series by Flame University that deals with interdisciplinary questions. My name is Aditya Sudarshan. I manage the university's writing center, and I'm introducing today's webinar, which, as you know, is about lockdown and post-lockdown effects on psychological services. So we're all deep into the coronavirus crisis, and in some ways we're coming out of it in terms of lifting the lockdown. But in terms of general uncertainty, that has not been lifted. I think the uncertainty about the new normal, as people refer to it, is even stronger now than it was a couple of months ago, because we're that much closer to this new normal and we still don't know what it will look like. So and a livelihood and economic crisis. The current scenario is also a crisis for our patterns of behavior and therefore for our psychological well-being generally. For this reason, today's webinar features not one but 3 professors of psychology from Flame. We have Professor Shalaka Shah from the field of organizational psychology, Professor Sairaj Patki, who works on clinical psychology, and Professor Deepa Bapat, who is a neuropsychologist. They are going to be addressing a wide range of questions related to, first of all, work patterns, the idea of work from home during lockdown, post-lockdown, then issues to do with therapy, the need for it, and how it might work in an online framework, if it has to be online. And finally, some more specialized psychological services and how they've been affected. For everyone tuned in, we'll have questions and answers after the panelists finish their presentations. Since we're touching upon many areas, feel free to raise any questions that occur to you or are on your mind, but we'll get to your questions at the end. In the meantime, you can send them in at any time using the question and answer tool, which you'll see at the bottom of your screen. So to begin with, I'll hand over to Professor Shalaka, whose area of interest, as I mentioned, is organizational psychology.
Thank you, Aditya, for a very brief introduction and also introducing the topic. As you all see also on the screen, the tagline for ConneXions says connecting the dots with an interdisciplinary approach. And that is exactly what we are attempting to do. We are connecting 3 different dots, even if it's a part of psychology. They address 3 different areas within psychology. So I will be talking about the area of organizational psychology and something that each of you will relate to, the experiences that we are having when it comes to work from home. So the dilemma, right, that all of us are facing right now is whether after June, okay, or after July, would you still be working in your home pajamas, or will you get a chance to, get ready and ultimately wear your office clothes? So of course, these 2 concepts represent the 2 roles that you play. Home pajamas, of course, talks about your role as a parent, as a family member, as a partner, and office wear, of course, represents your role as an employee and all that you do at your workplace. So let's discuss a bit about what would happen after lockdown. But before that, we need a recap. We need to create a base. So let's see what all happened in the lockdown, and let's see what we actually learned in this lockdown. So the first thing most of us probably enjoyed or didn't enjoy is, okay, just a sec, some issue with the animation. Yeah, so let me first talk about this issue itself, that you see the technical issues that you face when you are working from home, right? You think your internet will work fine. We checked all these animations just before the webinar, and now they're not functioning. Okay, so this is what happens when you work from home. I am going to see what I can do now. So the first theme that I was actually going to talk about is the household work and the household responsibilities that you have to cater to. So it starts with your house cleaning, to how to manage your home, how to manage your family members, what exactly you need to do, and how much they are able to contribute themselves in this work. The second aspect was about the experiences that we had, the technical issues that I'm also facing right now. See, this is actually not what I want to show you. Anyway, let's focus on this. So these are of course the positive things that we learned about, but I will just finish with the negative aspects as well. So the technical issues that we face in spite of having good internet connection, but the internet connection becomes patchy in some at some point of time. Then the issue is also about not being able to set priorities, right? Especially with participants here who have children, you will understand how difficult it is to work from home if you have to also take care of the child, and the need of the child for you to give attention, and still your effort to constructively engage the child throughout the day. So that becomes stressful. Another aspect that we really had to face in this lockdown is also that we absolutely couldn't go out, which means the kind of relaxation activities that you could do before, either it is sport or exercise or meeting or going to a restaurant or going shopping in a mall, all that was also stopped, which means these incidences or these activities also act as buffers. So they sort of help you to manage the stress, they help you to release stress, which was also not happening. So the recovery experiences, as we call them in psychology, were also very, very restricted. So that did not help much in your stress management. What you see in front of you right now is actually, these are the lessons that we learned in a positive way. So the first one, you see the digital literacy aspect, that, the lockdown forced us to actually learn new things, and not only us, the young people, but also the elderly. So the affinity with your mobile phones, or speaking to your family members over Zoom calls or Gmeet, or having virtual parties or dinners or lunches, is something that we also enjoyed. The second aspect is you start valuing the domestic help or the other kind of help that you have. Especially in India, it's very, very common to have such kind of help as compared to the Western cultures. So you probably think of your maid almost every day, right? Like how much she did and how much you have to do. And now if your maids have started coming, because some societies and some cities are allowing them to come, it also tells you how much time you save, okay? Because they are working for you. So you start valuing the resources and people around you. The third image talks about the youth and how this lockdown has helped the youth to constructively engage themselves. You see a lot of youth working as volunteers in different NGOs. Either it is food distribution, or it is about taking care of the patients in hospitals or medical camps. So this kind of opportunity is something that most of us have also utilized. The fourth image here you see is the family time, which just disappeared right now. Anyway, so the family time that you get with your family members, or also your extended family members, which was not that frequent probably before the lockdown. What else you learned is the life skills aspect, not only for your kids, but also for yourself. There are so many things that we actually learned to do during this lockdown. So this sort of makes you more independent. It engages you creatively, and you also start noticing and observing small things which you couldn't do before, right? So this work from home experience has been a bittersweet experience. What I also want to mention here is work from home, even if we see a lot being written about it on different forums in different media, we have to be slightly careful, especially applying that in the Indian context, because in India, as you know, the social interaction and the collectivist culture that we belong to demands a lot of social interaction. So you can't do without people for a very long time, right? So virtual meetings or something what we are doing today is fine. It's suitable for certain professions, like let's say IT sector, or the bank sector, or the education sector to a large extent has been dependent on this digital platform. But let's imagine a profession like being a pilot, or the hospitality industry, or someone who has a small scale business. For them, maybe work from home is not that suitable. So let's move ahead with, yeah, what happens after lockdown, right? So on personal level, let's see what are the three important aspects that we need to, be careful about when we are entering our workplaces. So the first one, of course, talks about the social distancing or the physical distancing. There's a lot being spoken about that now. That social distancing also, may result in some kind of social discrimination, and we rather want people to be away from each other physically so that there's no infection. So you actually can still connect, on a social level. In the sense, your social interactions can keep going by maintaining a social, physical distance. So this is going to be a change in our communication pattern when it comes to physical distancing. So we will still have to rely heavily on our devices to be connected with each other, but we have to remember to still have the human connect. Make sure that you care for the other person, make sure that you express yourself in a specific way. Also at the workplace, right, there are so many ways you can make the other person feel comfortable even at a workplace. So work from home will either continue from home, or your work will also be may start on site. So some days you may be working from home, some day you may be working on site. So there is a lot of planning that goes in that, especially if you have people to care for at home. If you have children, your children are going to this, they are not going to the school, but you are going to your office. So how do you manage that? Or if you are, if you were heavily relying on public transport to reach your workplace, and if that is still not in place, how do you manage that, right? So these are some stressors which are going to affect us even after lockdown. So we need to do something like a self analysis to understand our situation well and see how we have to manage that. The last aspect here is what just I briefly mentioned, reorganizing work-life responsibilities. So you have something like an estimate about what are the available resources at work and in your family. Maybe there's domestic help, maybe you have assistant at your work. So if the person is available or not available, that will actually decide how much time you have to invest in those activities, or you can delegate work and focus on what your main work area is. The same thing happens when it's related to your tasks, what you're expected to do. So we also need to reconsider our goals, yeah? And that is exactly what I will be talking from the organizational perspective. So personally, what we have to do and how organizations have to sort of prepare themselves in order to welcome the employees for on-site work, or if they want to continue work from home. So two aspects I'm going to focus on. One, I quoted as socio-emotional deficiencies. So we all have experienced different kinds of hardships, digital hardships, also other deficiencies, but the focus is also on socio-emotional deficiencies. We all are sort of, most of us could be in a depressive state, right? That you are low on motivation, there could be confidence issues, there could be communication issues, or there could be some people who are very anxious about going back to work considering the kind of home responsibilities they have. So the organizations have to sort of understand what needs to be done before you actually invite employees back on campus or back on your workplace. So the role of an organizational psychologist becomes very, very important here. So as you all may be knowing, organizational psychologists have the main function of mediating between the employer and the employee, and also understanding the psychological needs of employees and communicating them to the organization, and also designing assessments or testing plans for the employer in order to maintain or upgrade the employees. So what we need here before you actually start the work on your workplaces is a testing plan, a full-fledged testing plan to see what emotional, psychological condition your employees are in. If they are already stressed because of working from home, is there some way that you can, sort of give them a break and then, invite them to start their work? In-depth interviews will definitely help in this case. Online counseling is something. So what I want to also mention here is thanks to the lockdown that people are considering counseling once again in a very, very serious way. And online counseling initially did not have much recognition, and it was also seen as less effective as compared to face-to-face counseling and therapy. But thanks to lockdown, because you have no other option, you also sort of start viewing it in a more positive way. So counseling psychology and online therapy sessions are definitely going to help us. The last part that I'm going to cover in the presentation is about what approach in general we need. So we need to dare to cope with the changes. We need to come out of our comfort zones. So basically deal with the economic grief that all of us are going through, not only India, but globally. So we need to understand the kind of business losses, the livelihood that has been lost, and companies, of course, will do a financial audit, and they need to restructure. Right? So restructuring priorities is also one of the aspects here. We need not only an optimistic attitude, but we also need to convert this situation from a challenge into an opportunity, focus on strengths and work on our weaknesses. Goal setting has to be, should be more like a co-creation process wherein employers and employees together, if they are able to set the goals, then there would be less mismatch, and the workforce can actually perform in a very efficient way. Last aspect here is exercise human potential and focus on which competencies are going to be essential for the workforce to perform well. And as I said before, e-counseling services are the need of the hour. So employees should invest and employees should prioritize providing e-counseling services to employees so that employees are also psychologically fit to start their work. All in all, a work-life audit is going to help the employers to understand the current mental state, right? So the aspect of counseling and therapy will be explained in much more detail by Sairaj, wherein he will focus on the challenges and opportunities in the current situation. Over to you, Sairaj.
Thank you so much, Shalaka. A very warm welcome to all the participants. Shalaka has really laid down a nice foundation of what the challenges have been and how do we look forward from the lockdown. So as she mentioned, there are some professions that don't really fit in well with the whole idea of work from home or online work. And that's precisely what I would like to emphasize because there's always been this debate about how counseling and therapy could go on online. So without much ado, I'll just jump into the topic directly. So let's look at what are the basic core conditions when we talk about therapy. So unlike a manufacturing plant or unlike any other services, the most crucial aspect of therapy becomes the therapeutic relationship itself. So it's the relationship between the person who's seeking the help and the person who's offering the help that becomes the major component of the process. And obviously, when we're talking about a process like this, if it has to be successful, there'll be certain ideal therapeutic conditions that we'll be looking for. So when we're looking at it from the perspective of traditional therapy or face-to-face therapy, we first look at the physical conditions. When we say physical conditions, it's the environment in which the therapy is taking place. So to say, you're providing a safe space for the person who's seeking the help. So it could mean a very comfortable office, it could mean a comfortable setup, the kind of furniture that you have. The therapist is also physically present there to comfort the client if need be. Now, obviously, this will not be present, or these luxuries will not be present when we're talking about the online setup. The second half of the ideal aspects is related to the interpersonal conditions. So as I said at the beginning itself, therapy delves into the whole connection between the therapist and the client. And for that reason, the interpersonal aspects become really, really important. So when we're talking about these conditions, you're looking at the client investing their trust into the therapeutic relationship. And on the other hand, you have the therapist who is investing empathy, who's investing unconditional positive regard and acceptance for the client. Now, when you think about this from an online perspective, it could be a little difficult to have that trust built at the beginning. And that's what takes us to this whole debate about effectiveness as to whether online counseling is more effective or face-to-face or traditional counseling is more effective. And like Shalaka also pointed out that for ages together, there has been this debate and people always thought that online counseling was not so great. But a study by Lambert helps us understand how we could look at these factors. So if you look at your screen on the factors that contribute to the effectiveness of the therapy, 40% of the factors are anyway not in the hand of the therapist. So we are dealing with the remaining 60% of the factors. of which the therapeutic relationship again forms the core, contributing to about 30% of the effectiveness. So this 60% is where you would probably find some differences based upon what kind of technique is used, what kind of rapport is established with the therapist and the client. So that's where these differences between face-to-face versus online counseling could come into the picture. But very recent studies in terms of various meta-analysis conducted have now shown that as technology is progressing, as clients and therapists are being more trained, we have the effectiveness that's almost similar for both online as well as offline counseling. So now that we've set the base, let's move on to see what exactly happened during the COVID pandemic. So what you're seeing on the screen is the graph of the Google Trends, which shows what was trending online, what kind of searches were trending online in the past few months. And if you can see that April was the month in which online counseling as a search went on to reach its highest index of 100 points, which means that this was one of the most trending topics online. People were searching for online counseling services. Now, what does that imply for us? That means that there were people who were desperate to attain the services. There were people who wanted some kind of help. Now, there are some existing online platforms that obviously came forward and provided these services. There are many private practitioners who even offered free of cost services online. But many others who were in the traditional format found it a little difficult to adjust and adopt this new platform. So let's see how therapy is being performed at this point of time. So when we say online counseling, we can broadly divide it. Again, there are many types. Some people call it cyber counseling or cyber therapy. Some people call it e-therapy. But broadly, we could divide it into two components. One is what is called as computer-mediated counseling, which means that the online platform is just a means of performing a therapy. You will again have a real therapist. The therapist will be in interaction in a real-time scenario. So it's a synchronous form of therapy in which the therapy is being provided, just that the platform is going to be online. The other format, on the other hand, is asynchronous, by which we mean that it could be a 24/7 service that is offered and the therapist doesn't have to be present there. And that's what is happening in terms of new therapy chatbots being developed. So these are built based upon various AI or artificial intelligence platforms. They use a lot of machine learning techniques. They use a lot of natural language processing applications. And that's how they come up with chatbots that are trained by counselors and then provide 24/7 services. Now, again, there'll be a lot of pros and cons for each of these, and we could discuss those later if we have time during the questions. But overall, like what Shalaka has also mentioned, what this lockdown has done or what the pandemic has done is that it started a dialogue. It started a dialogue about mental health. Once the figures and all of these were coming onto the news channels, you also saw that people started discussing on news channels or on social media platform about mental health. Online counseling and people searching for online counseling. People who had probably never thought about mental health services started seeking those. So I think this paves a path for the way forward in terms of accepting counseling and therapy and also removing any taboo that would be there. Okay. This said, there obviously be some challenges with every field. So let's look at what these challenges could be. Technical issues, as Shalaka mentioned, will obviously be there. And when we're talking about technical issues, it also extends to the accessibility to internet, the accessibility to these online services. So are all rural areas accessible? Can we reach out to these spaces? And obviously, when we're talking about therapy, why this becomes much more crucial than just a webinar or than just a talk is because 70% of our communication and its understanding is built of non-verbal cues. So when a therapist is looking at a client or listening to a client, 70% of the non-verbal cues will be missed out if there's an audio lag or there's some glitch with a video. And this is very crucial data from the perspective of the therapist. This is the technical aspect, and there'll be many such aspects, which we all could have experienced as part of work from home. Moving on to the more personal aspect of a very philosophical way of looking at it. As a therapist, as a counselor, am I okay with online counseling? Do I click with technology? Am I somebody who does not trust technology? And how does that affect me providing services online? So that's the next aspect. Ethical concerns obviously follow. When you're looking at a platform like this, where possibly it's a meeting over Google Cloud or any other cloud storage services, or if the meet is being recorded, could the confidentiality be compromised in this case? So obviously there are ways and methods in which this can be taken care of, but still there could be this doubt about ethical issues that could crop in. And finally, online counseling opens up a huge plethora of options because you can now interact with clients who are not geographically bound to that region. So you could reach out to clients across different continents. But that also means that now therapists will have to be even more careful, even more sensitive to these different time zone differences, definitely, but even the cultural differences that come out in these various non-verbal cues when we are communicating. Moving on from the challenges, I mean, it's always easy to discuss what challenges are there, but where do we move forward from there? And obviously, it's not a solution that we'll have overnight. This webinar possibly is not the answer to this. We'll always have to work towards it. It'll take time, but we'll all have to work together. I'm so glad that we have a lot of therapists, a lot of practitioners, young students, all of them attending this seminar. So I'm sure that collaboratively, we will definitely come up with some solutions. So when we acknowledge that therapy itself started off as a service towards healing people, we are assuming that they had some clients in mind. The cohort of the client was in their mind. Now, what we need to acknowledge is that the cohort itself is changing. We have a lot of new, young individuals approaching for therapy, wanting therapy, because their worlds are also more cyber oriented. The problems are more cyber oriented. So we have cyberbullying, we have cyber infidelity, and many other issues coming up in relationships. And for that reason, this cohort sometimes could be much more comfortable with online counseling as against the traditional counseling. So I think it's time that therapists do start moving online and also offer services online. Does this mean that we should do away with face-to-face counseling? That's definitely not what I'm trying to hint at. Face-to-face counseling will always have its value and its importance. What I'm trying to say is that can we move towards counseling 2.0 or therapy 2.0? So it's not a solution that I'm suggesting. It's in fact a question that I'm asking every participant, that can we now think of having very formal training, very specific micro skill based training for our young students, for the therapists who are upcoming, for our interns, in terms of dealing with therapy, in terms of dealing with online platforms and providing this. So I know that this has been happening abroad, and the case study group that you see online has been there since the year 2000. But in the Indian context, I think there's a lot more scope for us to contribute to this. So this being said, I think I'm done with my talk here. I would like to have questions towards the end. What I've covered is a very general aspect of therapy and counseling, but two very crucial aspects of this is assessment and intervention. And especially when it deals with very specific population, the problems and challenges become even more intense. So I would like to call upon our next expert, Deepa, to throw some light upon this topic. Over to you, Deepa.
Thanks so much, Sairaj. All right. Am I audible? I hope I'm audible. Yes. All right. Great. So thank you so much, Sairaj, for that lovely overview of how therapy has had to adapt for the COVID pandemic. And a lot of what he spoke about actually also holds true in the case of when you're working with individuals with, say, cognitive difficulties, but there might be some additional constraints that arise. And that's really what I'd like to explore today through the lens of neuropsychological practice. So let me first give you a little bit of an overview of what neuropsychology is. It's basically the study of brain-behavior relationships. And more specifically, it's about understanding how any changes in the brain can impact our behavior, our cognition, and various psychological processes. So as such, the primary population of interest for neuropsychologists are individuals who are experiencing a cognitive impairment. So this could be secondary to a neurological insult, like say dementia, stroke, or a traumatic brain injury, or it could be individuals that are experiencing a psychiatric condition. So it's well known now that chronic and severe levels of anxiety, depression, and a whole host of other psychiatric illnesses can also result in changes to our thinking patterns. So what would be the kind of referrals then that a neuropsychologist would have? So moving on, you can broadly categorize that into assessment and intervention-based referrals. Assessment basically pertains to an evaluation of the individual's cognitive skills. So that includes their attention, memory, language, visual spatial processes, planning, organization, the whole you really want to try and sample all aspects of their thinking. And so why would this sort of an assessment actually be required? So it's very helpful when neurologists want to make a differential diagnosis. So for instance, does this person have Alzheimer's disease, or are they just one of those individuals that is worried well? We get a lot of referrals trying to identify strengths and weaknesses of clients, and we might also be called on to determine an individual's ability to return to work, say following a stroke or a traumatic brain injury. Are they able to return to driving, for instance? In terms of intervention, a bulk of the work is to do with rehabilitation, and that can encompass managing challenging behavior. So often that's managing aggression in these clients, kind of wandering, non-compliance is a big one, especially in the COVID era. A lot of work is to do with strengthening cognition, and of course the overall idea is to improve the client's quality of life. We also might be called on in an advisory capacity to aid other clinicians. So say if they're experiencing roadblocks in therapy, often this can be because the patient might not have insight into their limitations, and so they don't really want to work on it because there's nothing to work on and enhance. So that's something that we help with, and also helping our clients come up with goals that are realistic and appropriate, achievable for them given their skill set. Yeah. So the next question then is neuropsychology really an essential service? Can't we just put these services on hold for say 6 months and then revisit them later? So as I mentioned, we play an important role in terms of clarifying diagnosis, and without the right diagnosis, you can't really offer the right treatment. We also know that the gains made through neuropsychological rehabilitation are maximum in the first 6 months post-injury. So really time is of the essence here. You'd want to get a neuropsychologist involved as early as possible, say after a stroke or a traumatic brain injury. And then something more specific, I guess, to the current environment we're living in, a lot of the patients that we work with who have cognitive difficulties might be struggling to understand these new guidelines that have come about. And if they understand it, they might also have trouble adhering to it, which can manifest as behavioral issues, typically non-compliance. So to give you a concrete example through a vignette, let's say that we are engaging with a 72-year-old gentleman who has been diagnosed with Alzheimer's disease. You might ask him, do you know why you're meant to stay at home? Yes, some coronavirus. And a few hours later, if you ask him the same question, he might end up saying that I don't really know. My wife just doesn't let me go out. So without that understanding, and I'm sure the family is of course trying to explain that, but if it's not sinking in or if the person is forgetting that, they're not going to be able to comply with that behavior. So that's somewhere that a neuropsychologist can really be of assistance. So what then has this COVID-19 pandemic meant for neuropsychological services? So as most of you are aware, face-to-face services have become extremely limited. For a lot of the patients in our population of interest, many of them are reliant on family members to ferry them to and from assessments or consultations. And as Shalaka mentioned, there's this idea of role burden where our caregivers are also juggling multiple things. So this might not really be possible for them. In the areas where face-to-face services are available, it's often going to look like two individuals sitting at the end of a table, both wearing masks. Now remember, your mask is going to obscure half of your face, so it might not be the most pleasant experience. And again, we're missing out on all of those nonverbal cues, which, as Sairaj mentioned, are so important for building that therapeutic relationship. And if you think of individuals with kind of dementia or stroke, it's typically a disease of the elderly. And we are well aware now that these individuals are at increased risk for contracting this virus. So all in all, it would seem that teleconsultation is something that we have to embrace moving forwards if we want to continue delivering these services. But of course, this isn't without its challenges. If we think about adapting neuropsychological practice for teleconsultation, when it comes to assessment, we rely on a lot of visual material. There's a lot of manipulatives like blocks or jigsaw-like tasks, which of course, even with a visual medium or a video conferencing platform, isn't really possible to administer. All of the issues that Sairaj mentioned in terms of therapeutic relationship also hold true here. In addition, for any valid assessment, it is vital that the person in question understands what you're asking of them and they're able to remember those instructions as well for the duration of the assessment. So if you have any connectivity issues, again, that's going to be problematic. The assessments tend to be quite stringent, so you can't always repeat information. We don't have the liberty to say, let's just try it out on a visual platform today. If it doesn't work, we'll have you come in for a face-to-face assessment, because once the client is exposed to the stimulus, ideally you should not be retesting them for the next 6 to 9 months because it could result in practice effects. So assessment really is, teleconsultation is posing a lot of challenges for assessment. What about if we think of intervention? So in intervention, of course, maintaining the individual's attention can be quite difficult because you don't know what is happening at home. Maybe there are, when they're in the middle of a session, but they're actually also watching TV, for instance, right? So you don't have control over that. And a lot of the telehealth platforms that we are using so easily, like Zoom right now, might be something that individuals with cognitive difficulties are actually struggling with. It might mean that they need to ask their caregiver for assistance, and they might not be inclined to do that. So those are some of the issues, but thankfully for us, we can also highlight some opportunities. So in terms of assessment, I think it's really important just to prioritize and triage your assessments, figure out which are the most important ones, and then work through them in that order. There's going to be an increased reliance on verbal screens and questionnaires because these are tasks that could be administered over the phone potentially. It's a great time to follow up with patients who might have, not showed up for follow-up. Because we have all of this additional time now, I think it's very useful to see what is happening with that population. And thinking more broadly, I think it's also a wonderful opportunity for us to try and set systems in place to increase access for these services by rural populations, just generally speaking. So whether that means developing new tests, which are primarily verbal in nature, or you have multiple forms to avoid these practice effects, there's a whole host of possibilities there. In terms of intervention, it's actually lent itself reasonably well for teleconsultation. So the biggest, I guess one of the big benefits is that often the family members of the client in question are also at home. Now, rehabilitation is always a family process. You don't work in a vacuum. So it can be a great way to increase the engagement of the family. Another big plus has been that intervention can be offered a lot more frequently. So teleconsultations are typically a lot more exhausting. So you might not be able to have, say, 1 hour sessions, but if you were seeing someone, say, twice a week for 1 hour sessions each, right now you might actually be able to see them 5 times a week for half an hour at a time. And that increased schedule or the increased frequency of sessions is actually going to benefit them a lot more. So it's easier for them to see the results of the work they're putting in as well. It's helpful for the family also to see, and it basically gets everyone much more engaged with the rehabilitation process. And for individuals who are newer to the realm of intervention or rehabilitation, I think psychoeducation is a great way to get started. So educating the client and their caregivers about what the condition means, how it impacts the brain, how rehabilitation is actually going to help. So once they're equipped with that knowledge, they're in a really good position to move on to the next stage of rehabilitation. There are also some other opportunities that teleconsultation can present. So one is building, if we move on, we'll see that we can build strong therapist-client relationships. So on the next slide, please. So as Sairaj mentioned, that therapeutic alliance is very, very important. And this is something that has been a personal learning for me also. So that image on the left is actually a gift from one of the young men that I work with. He just gifted it to me yesterday. And I think it also really nicely captures the gains that he has made since we kind of increased the frequency of his sessions in the past 2 months or so. It's also a great time to generate awareness through things like these webinars. I'm sure, there's probably going to be a concept called webinar fatigue coming up soon after this, with lots and lots of avenues for more learning to happen. And lastly, I think it's a wonderful, wonderful opportunity to go back to those roots of being a scientist practitioner, where you really have the time to look at the literature, what have other people found, build that into your practice. So really looking at data-driven learning, being able to sit back and reflect on your own practice, where you went wrong, how you can improve, and learning from others as well. So I think I'll conclude with that. Thank you very much for your time. And I guess we can open up the floor to any questions now.
Yeah, so thanks a lot to all three professors. I think as we get to the questions, so there are a number of questions and many questions about the provision of these services, but there's also an anxiety. I think perhaps we should address that first. I think for the students who are attending the webinar, many people have expressed anxiety about how they should cope with the uncertainty that is surrounding, both how things are going to happen in the universities and also, I'm sure, for their future studies and the next steps and so on. So because that's an anxiety that's if you have any thoughts about how they can address it. So, like to address that therapeutically. Maybe Shalaka, if you want to talk about this.
Mm-hmm. Yeah. So when it comes to anxiety, especially for students, students also have to understand that professors also are equally anxious, because professors have not dealt with this situation themselves before, right? So anxiety is there everywhere. What we have to understand is how as a team we can look at this, right? Because I come from organizational psychology, and teamwork is something that is endorsed a lot in different contexts. So in this also you have to understand that professors are also going to use the trial and error method, try to make things easy for you, but we do not have any established methods to do that. So considering your own anxiety, the best thing also when it comes to the therapeutic angle is first understand whether your anxiety is rational or irrational, right? That is also what we have a lot of techniques to understand, that sometimes your anxiety is rational, is realistic, and you can identify it easily yourself. Sometimes you have to take help. So first categorize yourself accordingly. And if you think you need help, I think this is the time to address this issue. Speak to people like us, or if you know any other psychologists who are also providing online counseling, you should definitely go and address this issue and speak to them. So one is to categorize whether it's rational or irrational, and second thing is also to speak about it with the right kind of a person, and then the person can take it forward. So I think Sairaj can add here his perspective when it comes to actually addressing the issue from the therapist's perspective.
Right. So I'll also connect to one more question that was asked. I think there are many colleges that are actually extending the counseling services even during this lockdown. So I think that's already happening. I mean, we are obviously doing that, but there are many other institutes who are coming forward to extend the services that were otherwise offline to students right now at this moment. So I think that is one way in which we could deal with it. And like Shalaka has also mentioned in her whole presentation that if we look at this as one opportunity to look at things that we have missed out when we were working, things that we have missed out when we were on campus. I think that's one way to also look at it, by replacing that vacuum, because the moment you have a vacuum, it's usually filled in with negative aspects. So why not fill this vacuum with something that's more positive, something that's more constructive? It need not be a credit-based course. It need not be a course that you do in order to get a certificate. It has to be something that gives you joy. So I think that scope for personal growth, that scope for giving time to yourself, is something that we could have, and a little more reflection across different areas of life is what we could have.
Okay. Um, there was another thing which Shalaka, you had mentioned in your presentation, which was about some of the positives which came out of this period, or which are coming out of the period, is better communication, at least maybe within the family, people having conversations that they didn't have before, and also the valuing of people whom we take for granted normally, people who provide essential services. So Shibram had asked a question about how you can involve the community in helping fellow citizens in matters that need counseling. So I'm just wondering how, and also to first speak, to have greater awareness about the need for counseling, because that's also an issue which generally there's not much awareness about. Perhaps that's increased now. So how can we make sure that, as we go back perhaps to the way that we were doing things, that we keep these, these positives which we have developed of better communication and a better sense of community? Is there, is that something which we need to, in a concerted way, develop further so that we don't lose it?
Mm-hmm. Should I answer that first, and then others can add?
Yeah.
Definitely. I think this is a very good point. We do have a separate area of community mental health or community health psychology, which focuses especially about on this area where you can involve community when it comes to the awareness program. So one thing is that every one of us are realizing that we do have issues and we need to address those, considering the improved communication within the family, and not only in the family but also with our neighbors or anyone who needs any kind of help. We are eager to help them now, also because everyone is at home and you also do have time for that. But this approach has increased. We have become more empathetic than before. That is what I believe. So involving community itself in awareness programs, wherein you not only talk about one-to-one counseling, but there's also the concept such as group counseling, which most of the times we have to use also in social research. When the same problem occurs across a cluster, you have to look at it not only as an individual's problem, but to look at it as a group's problem, and then also identify what are the commonalities and what are the differences and how to address those. So I think what we have learned from this lockdown and from this crisis, as you already mentioned, the communication skills and this ability to connect and to come out of your comfort zone and comfort the other person. Usually what we do is we are being nice to people, but with a convenience, right? When it's convenient to you, then you usually do it. But this crisis has actually given us a chance to come out of our comfort zone and comfort the other person. So these are some values that we need to continue, and also focus on other communities and involve them in creating more awareness about mental health and address it as a group problem.
Yeah, adding to that, I think we could look at it as, ripples on water. Think of it that there was stagnant water for a while, and then suddenly this pandemic drops like a huge rock into it and has sent ripples across. These shock waves are what we're dealing with at this moment. We have not yet dealt with the situation entirely. So it's more of a firefighting scenario that we are in right now, and we're just trying to cope with that. But soon the longer waves, when those come in, when that gap between two waves comes in, I think that's the time that we'll have to extend this whole understanding to a much longer period. I think it's going to change the way we interact in general. It's not just going to be a one-off situation or just 1 year. I think things will change for a much longer duration because of this. And as we have said earlier, try to think of this as an opportunity to see how much more can we fill this vacuum with the positive aspects, and make sure that the ripples are more positive than, considering it like a shock wave henceforth.
Just
Okay.
to add a little bit to what Sairaj said in terms of getting the community involved, I think also not forgetting that one person can make a difference. So if you're concerned about, say, mental health in general, the next time you go grocery shopping or go to the medical store, you might a lot of pharmacists are actually dealing with a lot of anxiety because all of the people who need medicines are going to be entering their stores. So just checking in with them to say, are you all right? Have you been feeling anxious at all? Kind of sharing, having a chat about it, I think is also one way of making a difference at an individual level.
Okay, so now there are a number of questions which have expressed some kind of doubtfulness about online therapy and how effective it can really be. And I was wondering myself, especially Deepa, like when you're dealing with like very some specific issues, specific kind of traumas which need a particular kind of attention. Is there not a case for therapists perhaps to put their foot down and to there are some essential things which have to be done face to face. So as a community, is might that be an important thing to do, is to say, look, when we need to do face to face, then it has to be done that way. Otherwise, it's we're not doing justice to our clients.
Yeah, absolutely. So I think that's why I also mentioned about triaging. So you need to have a very clear idea of the constraints associated with an online therapeutic alliance and whether that is appropriate for your client and for you. So unless you feel confident delivering that service through that medium, I think absolutely it is fine for the clinician to say that this warrants a face-to-face sort of a session, because as you mentioned, I might not be able to do this justice over the phone or a teleconsultation. And certainly I think for matters that are very, very sensitive and where the person might not have that safe space to actually talk about it and disclose those issues, I think certainly face-to-face is the way to go. And maybe Sairaj would have something to add to that.
Yeah, thank you, Deepa. So I think there are 2 points that I would like to mention and add to this. First of all, it's that we are saying that online counseling is not going to replace face-to-face counseling. What we're trying to say is it can be a good supplement, it can be a good addition to your usual services, and you should always look at it as a supplement, as an addition. If you think of replacing face-to-face counseling entirely, that won't be a very good way of looking at things. And secondly, like we say it in counseling, one size does not fit all. So every therapist, every client, there'll always be one therapy that works even in a face-to-face scenario. REBD works for some, doesn't work for some others. The humanistic perspective works for some, doesn't work for the others. So it'll always be in terms of what works best for this client, what works best for my own understanding of what therapy is, and what works best for this particular situation that the client is facing. So it'll always have to be in that coordination.
I just want to add one point here, because the kind of doubts that are also mentioned in the questions, they relate to the outcome of the counseling session, right? Because we also, as counselors and therapists, we have our own evaluation methods of understanding how the session went, right? And were you able to achieve the goals that you had set for the counseling session or not? So what I'm trying to point out here is the quality of the counseling session. So it depends on two people, basically, the therapist and the counselee. So it's more of a responsibility from both ends, except for extremely severe cases wherein there are cognitive dysfunctions and the patient cannot really contribute well. Okay, for that kind of a situation, the online counseling may be something what Sairaj was suggesting as a supplement. But for other cases, I think if the counselee is also equally interested in bringing the change within himself or herself, building trust is not an issue, and that will add, especially to the outcome of the session. So I'm also putting the onus on the counselee and not only on the counselor to deliver the best, right? So it's again, like I said, it's a co-creation. So the goal that you create, even if you know slightly more about the therapeutic angle, the person many a times knows more about himself or herself than us, right? So what I'm trying to say is this kind of transparency and this kind of trust building, the responsibility is on the counselor and the counselee both. So the doubt when you have about online counseling, if you can, jump up this hurdle wherein you can have a trust between both. Online counseling works very, very well. Our long distance relationships work very well. Aren't we experiencing them right now? So of course, therapeutic situations are much more serious and of a different type. But what I mean is, the virtual world also is not as doubtful as it seems.
Yeah, I think that makes sense. So what I gather is that it's about putting everything in its proper place, and I guess looking at this as another element in your toolbox, which doesn't have to dominate, but depending on that context, that client, that relationship, it's something which is could be valuable, especially if the client also has concerns about face-to-face in these times. So just before I move on, it's interesting because the University of the Writing Center, we also do this. We also do consultations, right? And it's based on what people have written. So for the those who are logged in, it's basically consulting with students about their writing, about their texts, and what they were trying to say, how they can make it better, and so on. And we found that when we had to go online, in many ways, it actually kind of made everything better in terms of being able to focus on the text. Exactly. Of course, there were issues, there were technical issues, and just the strangeness of it. But it's not something that I would want to set aside, even if I could have every session face to face. Maybe there are times when perhaps you don't want all the other distractions. You just want to focus on the text with that person. So. Just leading on from that, there was a question that a person had asked about writing itself as a means of therapy, and whether this is also something which can be increasingly explored to conduct therapeutic sessions via writing as opposed to either face-to-face or video conferencing.
Yeah, so in fact, the first way in which online therapy started off, what we call as asynchronous therapy, was through emails. So people would send the therapist an email, and the emails would be read by the therapist whenever they had time, and then they would respond back to them. So that was the whole idea of starting of this asynchronous format of therapy. So as I said, it could work well with some who do not have that confidence or comfort level of meeting face to face. But then you're again also losing out on some other aspects of understanding the non-verbal cues or understanding the physical status of the client if it's not in a video format. But again, as I said, you have to see what works best for the client and for that particular situation.
Mm-hmm.
I think also journaling is something that people have been found to increasingly turn to manage their own stresses. So kind of it could be like just bullet points or keeping a diary or whatever. But I think certainly that is something that also many individuals find useful. And I guess that's more self-driven therapy.
Okay. Okay. So there just early on, there was someone, Sadashiv Nayak. He'd asked a couple of interesting questions, I thought, which are about, I guess, psychological trends which are going on around us and how we should think about this. So one thing he mentioned is that if you want to get things going again, then you want to have energy, you want to have a kind of consumption mindset. But if we're all in a work from home mindset, then as a community, how do we address that? That's one thing. And the other issue that he raised was about how this whole conversation about social distancing can push the untouchability buttons, as it were, which are also there in our society. And looking at certain people as unclean. And I mean, it's unfortunately easy for us to slip into that way of relating to people, right? And so how do we make sure that those things don't come up again? And the other thing he was asking is, how do you get people motivated and energetic to participate in the economy? I don't know if you guys have thoughts about this.
Maybe Shalaka, it's
Yeah,
kind of...
Shalaka, if you want to take it.
Okay, I can start. Yeah, so how to motivate people to come to work? I think the best thing would be, as I already said, that you could engage people in common meetings wherein you discuss, wherein you talk about how you've prepared the office, for example, or how you have prepared the campus for them. You send them, I don't know, some kind of trigger, some kind of interesting stuff, so that the curiosity is increased, and people would really look forward to join the campus or the office or the workplace. In general, motivation is something we will have to work on multiple levels. So there, self-motivation is one thing that you have to focus on, but also engaging in activities is something that we all need to keep doing, because we don't see anything starting, let's say, until September, right? So we still have 2 months to manage this situation. So being active itself, even if you're working from home, that sort of keeps and helps to keep the pace. And physical activity, anything that you can do indoor, anything, it could be climbing stairs or it could be cycling. Anyway, outdoor sport activities are something that you're allowed to do. So that definitely works on your physiology, and that in turn would affect a positive mindset. So that is one way of motivating yourself and being active. The second question was about the social distancing aspect. I think we already are we have fallen prey to this concept. We are calling it social distancing, and we are already discriminating. A lot of videos and news and articles about that. So we anyway have a sort of history, and considering the diverse society we are, either you have experienced untouchability, or you have read about it, or you were a part of it, right? So this lockdown just has changed the context of looking at it and how it is being exercised. So that's why I was also very conscious when I was using that term in my presentation. So I think physical distance is probably what we need to think of to control the infection and not to discriminate against the person who's infected.
I think also just reminding ourselves that it's the way you go about your own self-care and the precautions that you take that are going to trump everything else. So if you're outside and wearing a mask and ensuring that you're washing your hands regularly before you eat or touch anything else, you're following good sanitary practices, I think that's the biggest thing in terms of reducing your risk. So kind of, I think, really going back to the basics in terms of how are you reducing your own risk, and are you following those steps?
Okay. So we are we're at 6 o'clock, so we're done for time. I thought that there are a few questions also about, like, someone's asked a question about if you're facing anxiety and that's been elevated and you're seeking therapy for it, is it a good idea to continue with therapy? I would imagine that's a no-brainer, right? That you should continue with therapy. Yeah. So
it's like a magic wand, right? I mean, therapy takes time, because the issues that we develop haven't developed over a period of time. They have also developed, they haven't developed overnight. There are things that have gone into the issue being created. The same way, when therapy has to undo these things, it will take some time. And there will be ups and downs in therapy, but you will have to continue for at least a significant enough time to see whether it works for you. All this said, sometimes, yes, a particular format of therapy may not be suitable for a particular client. And that's when you could think of having a second reference and probably switching to another form of therapy. But even that needs to be given time. So it's not something that you can be really hasty about.
Yeah. Okay, there's a question which has been referred to me by Tasha about the psychological impact on students, specifically in the board year, who have to study at home among the constant pressure from all angles. I mean, I guess it's basically the question that we asked at the beginning, which you all spoke about students' anxieties and how there's no real easy answer to that, right? Because everybody is facing uncertainty. So I don't know if you guys want to add something to that. It just occurred to me, since we were talking about community, is that one thing for students also to realize is that education is also an essential thing, right? So as a community, we are all invested in their education. So one way or the other, the solutions have to be found. So it's not like people are just, it's not like educational services are just going to be going to be cut adrift. That can't happen. So even if it takes a bit of time, solutions will be found. I think that is an important thing for students to keep in mind. I don't know if you guys want to add anything to that, because it's basically the same thing that we spoke about. Yeah.
I think one anxiety that many people have is that will this badge be called as the COVID badge? Will everybody look at them with sympathy rather than empathy? Will, employers look at them in a different perspective? Okay, you've cleared your exam just because you got average marks, things like that. So I think what we need to understand is that it's a very global phenomenon. It's not something that has happened in a localized format, and everybody is trying to deal with it and be as empathetic as possible. It will take time, as I said. But we need to first get rid of this fear that we will be called as the COVID badge, because we all are into it. Like Shalaka said, professors, people who are running the institute, employers, everybody is into it. Obviously the issues faced would be different by different people. Some of them will be facing really much more major challenges, but I think that's what we are in this together, and we have to help each other out of this.
Okay, so I think we are, that brings us to the close of the webinar. It's important for you all to know that you will be getting the recording of this webinar, and you'll also be getting the presentations that were made, the slides, all of those who attended. And that will also contain the contact information of the professors. So some of you who wanted to ask particular things, or you wanted that contact information, you will get that. And beyond that, of course, I'm glad that you all joined. I hope that you will also join for the next webinar, which we have in the ConneXions series. That's on China's Belt and Road Initiative. So a subject from international relations, which will also be very interesting, especially for students, I would think. And thanks very much then to all our three professors.
Thank you very much.
Thank you.
Thank you all the participants for staying till the webinar ends. That shows a lot of patience from your end. Thank you very much.
Thanks, everyone.
Thank you.
Thank you. Thank you, Aditya.
Yes, thanks, Aditya.
Thank you.